Hi, welcome. I'm Catherine Jean Lopez from the National Review Institute, and I'm so delighted to welcome you on behalf of both NRI and the Charlotte Lozier Institute for this series around our issue of National Review End Row. I'm so happy to have with me Maureen Condit, who's Associate Scholar at the Charlotte Lozier and Associate Professor of Neurobiology at the University of Utah. And Tara Sander Lee, who is a Senior Fellow at the Charlotte Lozier Institute and Director of Life Sciences Program there. Thank you both for being here. Tara has a piece up on National Review online today, and Maureen, as I mentioned, has an article in the print special issue of National Review. And the focus of both of these pieces is the science of abortion and how the science of Roe is really outdated. And in Maureen's case, you focus on how the child in the womb suffers, and fairly early on too. Can you talk a little bit about what you wrote about in the piece?
Yeah, I was trying to help readers appreciate the fact that in the 50 years plus since Roe and Casey were decided, the information that we can rely on to inform our understanding of what's going on with abortion and what the status of the fetus is in terms of both when life begins and also when a fetus is capable of experiencing pain, have really advanced quite a bit. And well, there was some wiggle room for doubt 50 years ago. I think that wiggle room has greatly evaporated to the point where we have enough information right now to really have a good understanding of when a fetus becomes conscious and when it's capable of experiencing suffering.
And again, it's fairly early on where we are seeing indications that a fetus can feel pain.
Yeah, I mean, we know a lot about the neuroanatomy, about what circuits are necessary for pain to be detected and for an individual to react to pain. I mean, there's not a lot of controversy, and there hasn't been for a very long time, about when that circuitry is present in the fetus. The controversy has always been whether that information, the ability to detect a painful experience and to respond to it, whether that's a meaningful reaction to pain, whether or not the fetus is actually conscious of that experience, or whether it's more like a reflex response or something that could happen if you were anesthetized. So what has really advanced in the last, in the most recent years has been our appreciation for how aware the fetus is, for the fetus actually behaving in ways that would only be consistent with the fetus actually being conscious of itself, of its environment, of things that are happening around it, of input from its senses. And all of that really supports the notion that if a fetus has consciousness and has the circuitry to detect and respond to pain, then the fetus is experiencing pain in a way that we would call suffering, is aware of the pain it's experiencing.
Tara, thank you for joining us as well. Can you talk a little bit about the focus of your piece today on NRO?
Yes, absolutely. And thank you again for the invitation. So I really wanted to focus on, as Dr. Condit mentioned, there was so much advancement with understanding pain in the unborn, but I wanted to focus on some of the other technological advances that had happened in the last 50 years, in particular, ultrasound. I mean, ultrasound was just such an incredible advancement that happened. It was relatively new at the time of Roe, but it rapidly expanded since then. And so I wanted to walk the reader through what some of those significant advancements were. And as more advancements became available and more developments happened in the field of ultrasound, it opened up and made the window into the womb so much more clear, so that at the beginning of Roe, we barely could see the unborn inside the womb. And so I kind of wanted to explain what what were people seeing at that time, and how then over the years, what we see now, and how today we have an unprecedented view inside the womb with absolute clarity. And then with those advancements in ultrasound, how that opened up other fields and areas. And I mean, there are so many things that you could possibly discuss, but I really wanted to focus on the area of fetal interventions and fetal surgery, and how the ability to be able to better see the unborn inside the womb allowed physicians then to develop techniques and methods that would allow them to not only diagnose these birth defects inside the womb, but then repair these defects inside the womb. So there was this, it's been incredible, the number of advancements that we've seen. And these 50 years ago, nobody could possibly comprehend that expectant parents could one day use these sonograms to look at their unborn children's hands, feet, and faces and behaviors with absolute clarity. Not only, there's no way they could predict that they would actually be able to diagnose these birth defects and then let alone repair them inside the womb before birth. So I really wanted to open that field up, so that open up all those advancements and better, so people better understand just how far we've come, and that Roe is outdated and antiquated when it comes to the science and where we were, back then, and where we are today.
Right. I mean, I would second what Tara is saying, because the insights that we have into fetal consciousness and fetal learning and fetal memory are all because we can now watch the fetus. We can watch how it responds to things that come in from the outside. We can detect changes in its behavior that would indicate the fetus is remembering something it experienced earlier. It's opened up kind of a whole field of sort of fetal behavior and psychology that simply wasn't possible when we couldn't observe. We couldn't look inside the womb and know how a fetus was reacting, except in a very crude manner.
Maureen, could you talk about what that looks like? Fetal memory?
Yeah, it's so many of the people watching may be familiar with the notion of child psychology, infant psychology. How do we tell when a baby is aware of a concept, or when it detects something as new or surprising? And there are a number of ways that we can do that. For newborn babies, we actually put a pacifier in their mouth and see how fast they suck, right? So when they detect something as surprising or unexpected, they suck much faster than when they see something as same old boring. I don't recognize that as different. And heart rate kind of does the same sort of thing. You can detect changes in fetal heart rate that give you an insight into whether the fetus sees something as new or whether it remembers it from the past. And then you can present things to them, music perhaps that they had heard earlier, or nursery rhymes, have the mother recite a story. And by both watching how their faces respond, but also by detecting these measures of novelty, does the fetus actually recall this experience from before, we're starting to learn an awful lot about when and what fetuses pay attention to and how long they remember.
Wow. Tara, you talk about in your piece the surprise reactions sometimes you get from students. One of the things that gives me tremendous hope is that so many people don't know, and I think that's why they're pro-choice, as they say. And there's so much opportunity, whether it's the science of it or other aspects of it. What the pro-life movement actually offers in terms of resources. All of these things are so unknown. And the fact of the matter, you talk about ultrasounds. We live at a time where people post their baby ultrasounds on Facebook, and Instagram. Right. It's hard to pretend that there isn't life here.
Right. No, that's exactly true. I mean, it's like back then, I don't think we had that, right now we have no excuse, right? Like you said, people know that by ultrasound is providing a very clear view into what's happening with these babies inside the womb. I mean, back then during Roe, it was relatively new. The equipment was big and bulky and had very poor resolution. And so all they were seeing were, like white dots on a black background. And so they could barely recognize the heads or the internal organs. But then all of that shifted and changed. And like you said, today we're without excuse. Anybody that knows anybody that has had a baby or has had one their own knows that, at 15 weeks, that baby has fully developed fingers and toes and limbs, faces, and they can see the beating heart. And those are just the things that they can see. Science, as Dr. Connick has mentioned, is just revealing so much more about the behavior of these babies. I mean, we know that even as early as 15 weeks, it's already been predetermined whether they will be left-handed or right-handed, right? Whether they're going to suck their left or right thumb. I mean, it's just incredible how this opportunity to have a window and see what's going on inside has just, there are things that we can see with our own eyes. And then for those things that you can't see with your own eyes, through, when you go in for your doctor's visit and see the ultrasound, science is then revealing so much more in the studies that they're doing. And so it really is incredible how much more we know now than we did then.
Yeah, absolutely. I mean, it's, Tara was just mentioning that even at 15 weeks, a fetus is fully formed and has already certain elements of their behavior, their handedness, for example, being determined. But I think to me, the most compelling kind of new evidence that has come out is the evidence that really works against the narrative that has been repeated and repeated. Well, it's just a blob of cells. It's just a piece of tissue. It's just, or even if it kind of looks like a baby, it's essentially anesthetized. It's not aware of its environment. It's not making choices. It's not conscious. It doesn't have any memory or behavior that is anything other than reflex behavior. And all of that narrative has been completely blown out of the water by our ability to look with such great precision and true beauty at the behavior and things that a fetus will actually do. I mean, maybe some of the watchers and listeners have encountered, like in sports, the notion that we film athletes, right? And you then slow the films down and analyze the movements and that the athletes are making in very, very fine detail in order to help them maximize their force or, if their efficiency or to perform at a higher level. And that same science, which is very, very developed for mature people, can be applied now with ultrasound to infants, to get in the womb, to get a sense of what is it are they just flailing around randomly, or is there sort of motor planning? Are they anticipating what they're moving their hands towards? And what we see is at as early as 12 to 15 weeks, a fetus that's moving its hand towards its face will start out fast and then slow down and gain tremendous accuracy to touch themselves, to not poke themselves in the eye. And they'll touch their face, or if they're a twin, the face of their twins, with much more gentleness and accuracy than they will when they say touch mom's uterine wall, right? Where they do kind of flail, at least in my experience.
There's a phrase, Tara, follow the science. And so if we follow the science on this, I mean, what's your recommendation to the clerks and the justices on the Supreme Court?
My recommendation to the court would be to modernize the law. I mean, we need to have the law catch up and be reflective of where the science is today, because the science is so much further today than what it was at the time of Roe. And so the court needs to modernize the law to reflect what's going on today with our science. I mean, we know now that at 15 weeks, the ban that Mississippi has proposed, we know that at 15 weeks, all the major organs are formed of these babies. I mean, this is the science. These babies have hearts that are beating rhythmically. They are pumping 26 quarts of blood per day. We know that the heart is already beat about 16 million times. I mean, it is incredible what we know now about these babies. And as Dr. Connick has mentioned earlier, we know so much more about the suffering of the unborn at this time. And to ignore all that science And to just flat out say that it's okay to allow these babies to be brutally killed inside the room, and to ignore all the science that reflects the humanity of these babies, and their likeness to us. They're just smaller versions of us. That's the only difference. They have the behaviors and the pain and the stress response, similar, to, they're already, that's developing so far inside the womb. And so I think that's why the law absolutely needs to reflect that same science.
Maureen, without being brutal, I mean, can you give a little window into what the reality of abortion then is for a fetus, even early on?
Yeah. Well, one of the challenges of applying science to the subject of people's experience of pain is that it is literally impossible to crawl inside any other person's head and know what their experience of pain really is. What we have in older individuals is language. What we have in children is the ability to point to little pictures of, how sad someone is, or whether they're, as a way of trying to scale our understanding of what their experience might be. The challenge with a fetus is no one can know scientifically what a fetus really experiences. What we can know is when are the structures that in more mature stages are enough for someone to experience pain come into existence. When do they start functioning? We can measure that objectively. And then increasingly, we have the ability through ultrasound to observe the faces of individuals in the womb. And the behaviors that they exhibit are their way of communicating, are a kind of a universal pain language that is seen in dogs and cats, in mice, in horses, in all sorts of other domestic animals, as well as in people with altered states of consciousness, but is not seen in unconscious people. So when you're unconscious, you don't make these gestures, and when you are conscious, you do. So when people ask me, well, what does the fetus experience? I have to answer, I don't know. But increasingly, the fetus is telling us what they experience by using this universal language of pain perception. So obviously, if a fetus is conscious and the circuitry that's sufficient for experiencing pain is in place, which comes into place between 12 and 18 weeks post sperm egg fusion, so 14 to 20 weeks in gestational age, they would be experiencing being ripped limb from limb.
And that's why I think, going back to your question earlier, Catherine, I mean, the simple response to the courts, end Roe. End Roe. I mean, that's just, I think, the simple response that, I mean, we need to modernize the law, but that's why when you really look at this for what it is, it's time for it to end. And it's time for it to go back to the states and for them to decide. I mean, it's just, this is a very divisive issue, but the science makes it really clear. Makes it really clear what's going on with these babies inside the womb. And you can't ignore it anymore.
And I think if you look at the rationale that the justices had with Roe, it was based on uncertainty. No one really knows when life begins. And we know that eventually, at the end of the whole gestational process, we end up with a newborn. And most people would agree, if you're not philosophers who like to to argue against the notion that a newborn has rights, most people would agree that a born baby has rights and can be considered a person. So where in that span the state has a compelling interest to protect the fetus, was the uncertainty about that was the basis for deciding Roe the way it was decided. And I think so much of that uncertainty has just gone. I mean, we across the United States universally have anti-animal cruelty laws. Mm-hmm. And no one is arguing that animals are persons. They're arguing that it's inhumane and contrary to the values that we as a society want to uphold, that we don't cause avoidable suffering. And I think I think both the notion that we don't know when human life begins and the notion that we don't know when a fetus is capable of suffering have really been undermined by the advances of science in the last 50 years.
Last week, we talked about in this three-part series how if the court is going to tell the truth about law, it has to end Roe, and this extends to the science. If you want to tell the truth, then Roe has to go, because it's as you're mapping out, as you map out in your pieces, it's a lie to pretend that we're just eliminating a clump of cells, you know.
Mhm.
And one of the things, again, that gives me hope is that most Americans do not know that abortion under Roe v. Wade is legal in all 3 trimesters. No idea. Most people think it's early on. And that's one of the benefits of whether or not you agree with all the facets of the Texas heartbeat bill. Having to acknowledge there's a heartbeat at a certain point early on is something that starts to get people thinking and stop looking away from the science.
Yeah, absolutely. And I mean, and that's why I think it's become so important for when women know that they're pregnant, that getting that ultrasound early on, so that the mother actually sees that, yes, there is a living human being inside there, you know, as early as 6 weeks gestation. And, you know, that's changed hearts and minds just by that ultrasound alone, by seeing, oh, it's not just a clump of cells. There is a living, beating heart there. And then it just, from there, we know that it just the unborn just completely, you know, continue to develop more and more. And in fact, within the first eight weeks of post-fertilization, or, you know, 10 weeks gestation, that's where some of the most important developments take place. We know that by the end of that embryonic period, the baby has already formed about 90% of the anatomic structures. And for comparison, adults have 4,500 structures, body structures, and by the end of the embryonic period, it's estimated that these babies have 4,000. So yeah, that's 90%. I mean, there's a substantial amount of development that takes place just even early on within the first 8 weeks, and then by the time you get to, you know, the second trimester that we're talking about in the Dobbs case, I mean, it's incredible. It's incredible.
Mm-hmm. Maureen, we were talking in the green room, so to speak, about how you impressed some lawyers recently. Could you talk a little bit about that in relation to the science?
Well, I didn't do the impressing, but some of the data impressed them. So one of the more compelling pieces of new evidence, 2 papers that were published just this year, the first in January and the second in over the summer, have been using the 4D ultrasound technology in a very nicely controlled scientific design to really ask the question of whether or not we have direct evidence from watching a fetus who's undergoing a painful experience, that fetus is aware of the pain that they're experiencing. So the study involved doing recordings of the face of the fetus at rest after a startling stimulus, so something that would surprise the fetus but not hurt it. And then, because the fetus was undergoing surgery, a painful experience of injecting the anesthesia into the muscles of the baby. Then 3 blinded observers who didn't know what they were looking at scored the films using this very standard facial action coding system that, as I mentioned before, applies to animals and to humans in various states of consciousness, but is not observed when someone is unconscious. They got very, very surprising and very consistent results that a fetus would only communicate with these facial gestures an experience of pain when they were being jabbed by a needle, and not randomly when they were resting or when they were simply surprised. So the films are really very compelling. I mean, when you watch them, it's impossible not to see what they're showing you, which is the face of a child peacefully sitting there, and then the face of a child crying and screaming after something painful happens to it. So having shown those to some attorneys, they were very impressed with the clarity of what these videos are telling us.
And I just want to add on to that, because it's such an important point that, to actually see the facial expressions of the unborn that are feeling that pain with that injection, that the reason that they were receiving that injection was because they were receiving anesthesia for an in utero surgery that they were about to undergo. And so it's been recognized within, that's what I talk about in my article, just the incredible development and advancement and new modern era of the perinatal revolution, where you can actually repair these defects inside the womb of the unborn before they are born. It requires anesthesia for both mom and baby, because they recognize that they need to relieve the suffering of the child during these procedures. And these procedures have been documented in the scientific literature to have, in these clinical trials and studies, to they have been performed as early as 15 weeks gestation, particularly when they're talking about repairing defects for twin-to-twin transfusion syndrome, which is a serious and life-threatening condition for both babies caused by the connections in the blood flow between these twins who share one placenta. So this has been an incredibly successful surgery that has actually led to the survival of one or both twins. And so it's just, we need to remember that they recognize that these babies do suffer, and they're actually using anesthesia to relieve that when they undergo these in utero procedures.
That's amazing. But it's also amazing that the same medical establishment can be doing that and at the same time pretend that abortion is not the killing of an unborn child.
Right.
Maureen, can you talk about Stewart Derbyshire and why we should know his name?
Well, it's a pretty impressive story. Stewart Derbyshire is a neuroscientist. He was and still is a very strongly pro-choice advocate. His kind of connection to the question of fetal pain came about because he was one of a very small number of actual scientists, neuroscientists, who contributed to a review of the subject of fetal pain that was published by the Royal College of Obstetricians and Gynecologists in 2010. And that review took a very strong stance that a fetus was incapable of experiencing pain prior to the onset of connections between the spinal cord and the cortex, which starts at about maybe 24 weeks post spermate fusion. So his view of the literature in 2010 was absolutely solidly in support of the notion that a fetus could not experience pain before this point. And yet, in the intervening 10 years, data has really accumulated more and more so that circuitry that's sufficient for a fetus to experience pain comes into place much, much earlier. And so he kind of did an about face and wrote a review just a year ago in which he concludes that a balanced view of the literature, a fair and neutral reading of the science, indicates that a fetus is capable of experiencing pain perhaps as early as 12 weeks. This did not change his views on abortion, but it did change his views of the science. So, and I have tremendous respect for somebody who can look at the data and just say what it means.
That's remarkable. And you have another example of, you make a choice. We're going to tell the truth, or we're going to adhere to an ideology that we're invested in.
Yeah.
I just want to say to anyone who's watching live, you can ask questions in the chat box. And someone asked, what is the name and the spelling of the scientist being discussed right now? I think we're talking about Stuart Derbyshire, STUARTDERBYSIRE, to answer that question from Samuel. Tara, can you talk a little bit more about this perinatal science because you have, again, this paradox. You have this incredible advanced technology happening, but at the same time, you have women being pressured to have abortions when there are abnormalities, and especially if she's poor. One of the Sisters of Life, who devote their lives to helping moms, says that in New York it's a search and destroy mission for some doctors. So you need to have moral support with the mom, the pregnant mom, when she goes to the doctor, because any excuse to push toward abortion, that the doctor's probably going to bring it up. How do you square those two realities?
Yeah, I mean, I think that is the reality that we're in right now, because with scientific advancement and the developments that have been made, especially within the field of diagnostics. I mean, we talked about ultrasound earlier. I mean, right now it is routinely a 20-week scan is routinely done, and that's where they often detect structural birth defects. And if one is detected, such as spina bifida, they will give the family the option to abort. And it's so unfortunate, because science has advanced to the point where they have demonstrated that, whereas before performing the surgery after birth was kind of the routine practice, now they're finding that performing the surgery before birth actually leads to better outcomes. And so just even informing parents of this other option, and that abortion is not your only option, and that it actually is going to lead to even better increased quality and survivability of your child, is incredibly important. And we also see within the field of diagnostics, just even the incredible capability now where we can non-invasively go in and take a blood sample from the mother early on in the first trimester, and can detect the fetal DNA that is circulating through the mother's blood. And that's allowed scientists to be able to detect some of the chromosomal aneuploidies, such as Down syndrome or trisomy 13 or 18. And again, we find that, yes, women are being pressured. Once they get a positive test result, they're given the option, they're very pressured to get abortion. We know that even if a woman receives a positive diagnosis for Down syndrome, that in the States right now, there's on average a 67% abortion rate once you detect a positive result. And we know that there's even problems with these positive results. They're not always positive. Positive doesn't necessarily mean it's truly positive, because it's a screening test, not an actual diagnostic test. But yes, there's this with the advancements in science, that can be used for both good and bad, right? Unfortunately, many have used that science, those advancements, and they take that knowledge that to actually justify the killing of a child. But we see that there's now interventions that can be done for some of these cases that can help actually repair the defect. In addition, like we know with Down syndrome, these babies, we know that science has showed us that over the years, they now have a life expectancy up to 60 years in some cases, and they can lead happy, healthy lives. And so, there's this kind of conflict with advanced science. Sometimes they use it as that scientific advancement has been used to actually abort, because they have that knowledge early on. But we also have to give these mothers all the information and all their options, because there are options to actually repair that defect. There are often options to actually prepare for that child after birth to have the medical care that they need, so that they can have a higher quality life. So yes, this is kind of, science has advanced so much, but there are so many things that families need to be better informed, so they understand the full picture and what their options are.
Mm-hmm.
Maureen, if you had a couple of minutes with a Supreme Court justice, how would you lay out the case for ending Roe on science?
I am not a political scientist. I am not someone who is an attorney and who has a good appreciation for these things. And so as a scientist, I would simply urge the justices that solid and fair law needs to reflect reality, needs to reflect what we know about the nature of the unborn, about when life begins, about all of the advances that Tara and I have been discussing with you in this broadcast. And those things have to be taken into consideration, that abortion is a very complicated question. And I think everyone here appreciates the difficulty for a woman facing an unwanted pregnancy, the difficulty for a woman facing a child who may have major medical problems at birth, the difficulty, of course, and the horror of someone who's been a victim of a crime. I think we all appreciate the complexity of the situation, but we can't make a just law without the law reflecting reality, and the science really needs to be looked at. How I would advise them to balance it, like I said, I'm not a political scientist, so I'm going to stick with the science and just urge that the science needs to be considered.
Well, there's a lot of concern that the justices will take into consideration politics, and that the culture isn't in a place where it could handle Roe being overturned. But that is why it's so important for us to be talking about the science, because the culture will get there if the culture knows what it's talking about. The culture doesn't know what it's talking about right now, out of either denial or ignorance, or a mixture of the both. And so thank you again for both of you for the work that you're doing in talking about the science and educating people. One of our questions is, ultrasound has been a powerful tool of learning about fetal life and neurophysiology. Have other methods like PET scans and MRI had usage in fetal surgery and medicine that provide additional insights to fetal neural function at the cellular and molecular level that also indicate the level of neural and brain function? For either one of you.
Well, I'm not a neurologist, but what I can tell you is that MRI, yes, has played a significant role in better diagnosing. I mean, just alone with MRI being able to see clearly the spinal cord and all the skeletal structures. My understanding is that MRI has been very important, as well as the ultrasound, to better detect and rapidly diagnose some of these structural abnormalities, particularly those like that affect the spine, such as the neural tube defects I was talking about earlier, like spina bifida. So that's my understanding. I don't know if Dr. Condit has anything else to add to that.
I think a lot of these other imaging techniques have given us insight into what kind of functions are being supported by the nervous system at various stages. So we've had a pretty good understanding of the neuroanatomy for a very long time, but it's harder to know when someone is actually using that anatomy and how they're using it. But because of the advances in various kinds of imaging techniques, we've been able to get a better picture of the functionality of various neural circuitry at different stages during prenatal life. So that's been helpful too. It's just making a more three-dimensional picture and giving us more insight into the mental life of a fetus.
It's such fascinating. It's just fascinating, isn't it? And one of the beautiful things is that, you know, we've had instances where Time Life magazine, or some completely mainstream, not ideological outlet, just it's sort of pro-life because the science is that, you know, you don't have to be pro-life to find this fascinating. And it really speaks to how politicized this has been, that people aren't like excited about this. I mean, this is more exciting than Captain Kirk going up to space, and yet we're bogged down in such politics. We can't even have normal conversations about what's right in front of us, and so amazing.
Mm-hmm.
Well, as an embryologist, you know, I find the embryo amazingly fascinating and beautiful, and an endless source of surprise. But I can see, again, I think it speaks back to the complexity of the issues. I think one of the ways that we as humans try to deal with complex situations where we're weighing and balancing the interests of more than one individual is to simplify the question, and it's very hard to look square on at what the evidence shows, and because that forces us to have to balance things that are hard to balance. And I think if anything, that's why there's such a strong tendency to sort of dismiss the facts as, those must be pro-life facts instead of just scientific facts. I mean, facts that actually are there. And to simplify the notion of consensus, that even though consensus isn't a great way to take the pulse of what the science says, it's a simpler way of looking at the picture and saying, well, point to a scientist who would conclude that a fetus experiences pain, and there are very few to point to, but there's a lot of evidence.
And what does that say about medicine?
Well, it says medicine and science are done by humans.
Right.
is how I would interpret it. I think.
Yeah.
I think it's surprising how complicated science really is, and even for people who are experts, it's challenging to stay abreast of the literature and to interpret it. So we tend to know our own little wheelhouse of what kind of research we do and what it means, but we tend to go to reviews and to experts in anything outside of our field for the conclusions and interpretation, and that can give a tremendous amount of influence to big reviews of the literature. For example, the ARCOG review that I mentioned from 2010. It was the opinion of a number of scientists. It wasn't a shared opinion of everybody in the field at the time, but it became sort of the dogma that this is what science says. And it relieved people of the obligation to go and actually look at what the literature really says.
Well, and I think, we recognize that is one of the issues with science where it is. Like Dr. Condick said, science is advancing so quickly, it's hard for even scientists to keep up with it because there's so many different fields and specialties. And so, one of the main focuses of the Charlotte Lozier Institute within the last 2 years has been to do research on fetal developments and make it easily accessible and understandable to the public. And so we put together this website called the Voyage of Life at voyageoflife.com, where you can go stage by stage, including the 15-week stage, related to dogs, and see some of the key important aspects of that developmental stage. If you go to 15 weeks, you're going to see information related to what I was talking about earlier, about how the body responds to touch and feels pain. And so we just encourage you, we've done this research so that people don't have to. So we encourage you to also, so that information is going to be more easily accessible and hopefully helpful in the months ahead.
One of our live viewers says, while hearing the discussion on when a fetus's heart first beats and when a fetus first experiences pain, I'm concerned that emphasizing such factors can be interpreted to mean that a preborn human must have a beating heart or the capacity to experience pain in order to be biologically classified as a human or legally recognized as a person. Am I alone in feeling this tension? I'll open to both of you, but part of what we're trying to do over this 3-week virtual series is talk about some of the issues that are brought up in the special issue of National Review. And so part of the case against ending Roe is the science. So there are other articles to speak to history and morality and other things, but our focus here today is intentionally to be focused on the science. But Tara, you look like you wanted to say something.
Yeah, no, I wanted to, I understand, you're right. I mean, when we start to give information about, when the heart beats, when pain, but it's absolutely scientific fact that at the moment that the sperm fuses with the egg, that at the moment of fertilization, that embryo, that early embryo is a human being and is a human organism, unique and unlike any other on the planet. And so those, we know that this has been well defined, and we know that this process is indisputable proof that from the moment of conception, that this is an integrated organism, a human being, biologically distinct, and these dynamics of fertilization and human development are well established. So even if you're not focusing on the heartbeat, but you're focusing just on that very initial stage of when the sperm fuses with the egg, that is a human organism. And so I know Dr. Kodnick knows this area very well, so I'm sure she can give you even more specific facts.
Yeah, I think the challenge here is not the facts. I think the facts are really incontrovertible. And I think it's much more a question of interpretation and value. Very few people will argue anymore that we don't know when human life begins, because it's just that the evidence is just far too clear. But lots of people will argue, okay, so it's a human organism, it's a human being from this instant of sperm egg fusion, but it's irrelevant, because what's really important here is the question of human value. When do we as a society have an obligation to respect the interests of the fetus or the embryo? And, I'm not any more a philosopher than I am an attorney or a political scientist, but I'll venture out, I'll dip a toe or two into that pool. The question of human value and how we decide it. I talk about this topic, when does human life begin, with audiences all over the world and from all walks of life. And I've always asked people to tell me what they think of, what are the ways that we as a society can decide when a human has value and has rights and is worthy of protection and respect. And it really boils down to pretty much three different ways. Either we decide a fetus has value or another person has value based on something that they can do or something that they look like. So consciousness, or the ability to survive independent of the mother, so viability, or self-awareness are common things that are proposed as ways that we decide when a fetus has value. But I find these very problematic, because we as a society really truly believe that in the concepts of equality, and that we shouldn't give greater rights to smarter people or more beautiful people or stronger people or richer people, but that all people should have the same rights. And in every other dimension of law, we uphold this value of equality very, very strongly. So carving out this exception for the fetus and saying this human person or this human individual only has rights when they achieve some mark that we set, is really quite contradictory to the way we understand human value in every other context. So what's the other way? The other way is basically authority. People decide as a consensus of the governed who has rights and who doesn't. And yet this also defies very much so our notions of equality and justice. If we're to let society just make a judgment as to who has rights and who doesn't, well, what if society decides that all women over the age of 50 with brown hair, sorry ladies, aren't humans and don't have rights? I mean, this has happened historically. I mean, we can joke about it, but we all know examples of this having happened, where the majority of the government simply decided that Jews, or that people with mental defects, or people who oppose the government weren't humans. And how can we possibly object to that if we're willing to make that kind of a judgment about a fetus, simply because fetuses don't vote? So the third and final way is intrinsically, that you have value simply because of the kind of thing you are. and that humans have value because they're the kinds of things that should have value. And if that's the case, then all humans at all stages, regardless of their abilities, regardless of what they look like, regardless of what some people might think about it, all humans have value because they're humans. And that would apply to the one-celled embryo as much as to my aged mother, as much as to women with brown hair over the age of 50. So if there's another way to get at this question, I'd love to hear it. But thus far, those are the only three ways that I've encountered. And I think it's a hard thing for us to accept. It's hard to look at a very early embryo and say, well, that's a human person. But what are the alternatives?
Yeah, I agree. And I think, and to say that, well, they're dependent upon the mother. But then I think we can go that step further and say, but there are people within our society that are dependent upon others. So does that mean that the disabled then, if they're dependent upon somebody, are not human beings worthy of respect and protection, and have human rights? Does that mean that the elderly, I mean, you could go, does that mean that those that are born, those that are born the day that they're born and are completely dependent upon everybody around them for survival, does that mean that they are not worthy of protection and human rights? And the answer is no. So that's why I agree with everything that Dr. Kondik just said.
It's also a reality that we're all dependent in ways, I'm in Chicago today. I couldn't get there without a string of people who I will never know, we're interdependent. And we're weaker than we realize sometimes. And if we realize that, I think we would be more sensitive to the completely vulnerable. There was a telling response to the Texas heartbeat law where some people said, you realize this means there are going to be more people with Down syndrome. Well, yes, I am aware of that. They are not subhumans to be eliminated, and yet that's what we do in our culture. And so again, having these conversations is important, not just as a court issue, but as what are we as a society, and what are we choosing? As we've said before, in some cases this is there's ignorance about this, but in other cases, we're choosing what to talk about and what to focus on and what to acknowledge. And yes, as Maureen pointed out earlier, we are not insensitive to the myriad issues that a woman who is pregnant may face, including the circumstances of the pregnancy. And we know that this is a painful circumstance that many women find themselves in. But to pretend that it's not a developing baby is not doing anyone any service, especially that woman who's a mother.
It's really important for us to acknowledge that a lot of the rhetoric in this field is not about the rights of women, and it's not about the rights of children. It's about us feeling comfortable doing nothing.
Right.
We all give lip service to diversity, but what does diversity really look like? I mean, I'm a huge fan of diversity. I actually really support diversity, but I'm willing to accept that diversity does look like an individual with Downs, and that what they bring to the conversation and to society and to our interactions has value, because it is a different way of seeing the world. It's a different way of living your life. It's a different way of being a human. And that's powerful. And that helps us to have a more three-dimensional view of what humanity really is. So we got to face that. We've got to face the fact that if we support diversity, we've got to support humans in all forms and in all levels of ability and in all shapes and colors, and with different perspectives. And similarly, if we are going to say we respect women and we want to support them, we can't give the easy off answer of, well, here's how we support women. It's a one size fits all. She has an abortion and everything's great. we need to man up, step up to the line and provide support to people who need support. Give resources to people who need resources, not just information, but all of the things that may make it challenging for someone to face an unexpected pregnancy. What are we doing as a society if we have the easy answer of, well, this is the fix it for everybody, when in many cases it's really not.
It's also such a disservice to women to suggest that they can't rise to the occasion of a difficult pregnancy, difficult circumstances. Single mothers are amazing, right? Most of them not single by choice, but they find themselves pregnant and the man doesn't man up, and they have the baby, and it's just amazing. Whether they wind up choosing adoption or they wind up raising the child, they're doing courageous work, and we should acknowledge that. And women can do pretty amazing things to protect their children. And we should be telling some more of those stories rather than pretending that it's empowering the women to have them eliminate their unborn child.
Mm-hmm.
We have about 2 minutes left. So Tara, I want to give you a last word, and then Maureen before we have to close.
I think my last words are just that science has advanced remarkably in the last 50 years. We need to recognize it for what it is. We need to look that face to face. We need to recognize that science has given us an incredible gift that reflects the humanity of the unborn and the likeness of justice, the likeness that reflects the humanity of the unborn. So I am encouraging the court to just acknowledge it for what it is, and that their decision is to end Roe and to have our abortion laws reflect the science.
And if you are watching this live, I shared some links to some visual images that were part of this discussion. And if you're watching this on YouTube later, look for a post on National Review Online's corner from me, and I'll include some of those links. Maureen, final word.
Final word. Thank you for giving me this opportunity to speak to your audience and to encourage them that, as Tara said, as I think we've all said, science matters, that a just and equitable decision in the complicated issue of abortion has to be based on what we actually know to be true. Otherwise, we're just making up reality as we go along, and that is profoundly anti-science.
Absolutely. Thank you again, Maureen Condit and Tara Sander-Lee. Maureen has a piece in our End Roe issue of National Review, and Tara has a piece on nationalreview.com today on the science, both of them. Maureen specifically on the suffering of the developing baby in the womb and what we know about that. And this webinar, virtual event, whatever you call it, is the second in a series unpacking some of the issues in the End Roe issue of National Review. And next Monday at 2 Eastern time, I'll be joined by Carrie Severino and Erica Pack-Giochi to talk about some of the cultural issues. Erica's the author of a book on the rights of women, and I think you'll find her presentation very, very informative. So thank you again, Tara and Maureen, and thank you on behalf of the National Review Institute and the Charlotte Lozier Institute for joining us. So please share this video on YouTube. You'll find it on the National Review Institute's YouTube page.